Hello and welcome to our very first Wednesdays with Wildcats here at Culver Stockton College. My name is Dr. Jay Hoffman. I'm the chair of athletic training and health sciences at Culver Stockton College. And as I stated before, this is our very first Wednesday with Wildcats. And I want to use this as an opportunity to educate folks out there a little bit about what athletic training is and even kind of the goings on of athletic training at Culver Stockton. We emphasize that AT in the Wildcat as in athletic training. So with our very first Wednesday with Wildcats, I thought maybe what I'd do is talk about, what is athletic training. So some of us out there, if you're watching this, you 100% absolutely understand what athletic training is. And other of us may think we know what it is or may not have any idea at all. So this is a good opportunity for me to share with you what my perspective on athletic training is. So athletic trainers are multi-skilled healthcare providers that collaborate with physicians to deliver patient services and produce good patient outcomes. So I think the biggest thing to remember out there is athletic training, it's not personal training. It's not just, taping ankles or giving water. We are allied health professionals. We are recognized by the American Medical Association as a healthcare provider. And we provide really important services to our patients that keep them safe and drive good patient outcomes so that they're participating in physical activities and the most effective manner possible, and again, in a safe manner. So if you kind of look at the continuum of athletic training, what is it that we do? A big important part of what we do is actually prevention and wellness. So we want to prevent injuries from happening, which may include physical conditioning of some sort, but it also includes biomechanical analyses. It includes making sure that we do get the water out there, and or we're monitoring the inclement weather and ensuring that these injuries don't happen. Unfortunately, the injuries do happen, and so there's really two injuries and illnesses, I should say. They do happen, and we have to have two important components. One is our ability to react in emergent situations, and the other is that we have the ability to clinically examine and diagnose these patients appropriately. So in an emergent setting, we're often the first ones on the scene, and this is why athletic trainers, especially when you look in traditional settings like your professional athletics, high school athletics, and college athletics, we're the first ones on the scene when there's an emergency in these athletic populations. And so we're there before the EMS even arrives. And so our ability to intervene and react appropriately is so vitally important to the outcome of that individual. In those kind of semi-emergent or even non-emergent situations where you maybe have a musculoskeletal injury, a common one you might think of is like, say, an ankle sprain or something of that course, we need to be able to appropriately clinically examine and diagnose that and determine, does this warrant a referral to another allied health professional who's going to best drive their care? And in many cases, that is the athletic trainer. But if it's not, we're the ones that make sure that they get to the right folks. Then what we do is we typically move on to the rehabilitative process. Okay, this is a therapeutic intervention. This could be musculoskeletal in nature, the traditional rehabilitation. Maybe we're using some sort of treatment methods or therapeutic modalities like STEM, ultrasound, and things of that nature to try and get this person back into the best physical performing level that they were before, or at least restore them back to their prior function. But it also might include pharmacological intervention. As I noted before, again, depending on what state you practice in, it really kind of drives our standard of care and our scope of practice. But we deal with injuries and illnesses. Think about it. You may very well have an athlete out there that's participating who has sickle cell, or perhaps they're a diabetic. And an athletic trainer's knowledge of that and their ability to intervene is really important, not just in the emergent or clinical diagnosis component, but also in the rehabilitative process and understanding where they are and what needs that particular population needs. And that includes a population throughout the lifespan, all the way from pediatrics to geriatrics. So the breadth of knowledge of an athletic trainer is amongst, in my opinion, some of the most in allied health professions out there. The next thing we want to talk about is kind of the return to play aspect, or the return to activities. We have to be able to appropriately return individuals back to their activities to ensure that they're not going to return back and either be injured again or exacerbate that prior illness that was in place. Another important part of healthcare and athletic training is that we're involved in organization administration and professional well-being. We have to maintain healthcare records, and we have to drive quality outcomes, and we do that through quality improvement. We do this through the tracking and use of healthcare informatics. And then the other part of it is we have to stay on top of the current trends and what's going on and what's driving good patient outcomes. And we're required to have 50 hours of clinical education units every 2 years. And we do that in a variety of different ways, but really we're just staying on top of the literature, and in particular, evidence-based practice. 10 of those 50 CEUs are required in evidence-based practice. And again, this is using the best available evidence to show and drive good patient outcomes. And athletic trainers produce good patient outcomes because that's what we're focused on. We're focused on our patients. I think it's one of those innate abilities of athletic trainers to really connect with their patients in kind of a grassroots, down home kind of way. And I think, again, it's what I love about the profession. It's why I got involved in the profession. And I think it's why our patients relate so well with us. So I hope that gives you a little bit more context and background about what athletic trainers are, kind of looking at our domains of practice from prevention and wellness through the clinical examination, all the way into the organization administration and the professional development component of our profession. If you want more information about athletic trainers, I'd highly encourage you to visit the National Athletic Trainers Association, www.nata.org. If you're in the general public and maybe you know a little bit about athletic trainers and you do or don't have one in your particular setting, and you want to advocate that, prefer that, or learn a few more facts, you also can visit www.atYourOwnRisk.org. There's a lot of really good information and statistics and things on that. If you're a prospective student out there, or a parent with a young person who has an interest in sports medicine and possibly athletic training, you might even check out our website for our Masters of Athletic Training at Culver Stockton at www.culver.edu/MAT/, or you can also follow us on Twitter at Culver, CULVER MAT, at Culver MAT. I hope you enjoyed this very first session and learned a little bit about what athletic trainers are. And we're very excited to have you here with us on our very first Wednesday with Wildcats. And just remember, it's a great day to be a Wildcat. Go Wildcats.